very much. And I think I will be right if I say good afternoon and good evening, because most of our colleagues are from Asian countries and they must be attending this from their own countries. Let me first thank Professor Norman Sartorius, Professor Dinesh Bogra, and more importantly, very dear friends, Santosh Chaturvedi and Mohan Isaac, who have helped Dr. Philip, Dr. Sachin, and the committee of IPAT for organizing this very important and timely meeting. This is indeed a great opportunity that our trainees are not only taking more interest in promoting psychiatry, but more importantly, they are also working very hard to develop their links and share their experiences with other trainees from all over the world. I will be just giving you a very brief overview of how this particularly a new group could collaborate and link with some of the international organizations. As all of us know that we are now living in a global village. And whatever we do, that is known, that is shared with so many others who are coming from different parts of the world. Representing World Psychiatric Association, I would like to just share this with some of our young colleagues who may not be aware of some of the historical perspectives of WPA's contribution in psychiatric training, in promoting early career psychiatrists, and emphasizing the need of recognition of the requirements for our future psychiatric trainees. Let me start with Professor Norman Sartorius' contribution. As a past president of WPA, he has been a great leader in developing, promoting, and strengthening leadership programs.
Do you think we could just get an idea of how many people from India are there?
All over the globe. And then, in addition to this particular role, specifically his support to our Asian trainees have always been great. And he has been holding these the training programs for leadership in psychiatry in many ways in many Asian countries. And we were really privileged from WPA's perspective and also Asian Federation of Psychiatric Associations platform that he always promoted this leadership training to all our fellows, all our younger colleagues. The second thing which I am sure that all of us will acknowledge, the role of Professor Norman Sartorius and promoting WPA's role in disseminating the educational and the higher training needs, especially in low-income countries. Similarly, Professor Dinesh Bogra, who is also a past president of WPA, during his presidency, he has done a number of initiatives, but particularly relating to the psychiatric training. Two of his actions have really gone very well in terms of the psychiatric trainees. The first one, during his time, WPA was able to establish early career psychiatrist as a scientific section of WPA. That really brought the early career psychiatrist and the young psychiatrists to the platform of WPA, which is very important. And just taking clue of his initiative and vision, what we are now doing, and especially during this current triennium that I'm chairing as the lead of the WPA, we have made a point to involve young psychiatrists in all our committees, in all our activities where WPA is producing guidelines, position statements, or any other related matter. The second thing which I must pay tribute to Professor Dinesh Bogra, that he established WPA collaborating centers. And I'm pleased to tell all my younger colleagues that I have taken a sort of further steps to make sure that these collaborating centers work more importantly in terms of teaching, training, and higher training. Professor Chakravarti was the director of the WPA Collaborating Center from NIMHANS, and I'm now really pleased and privileged that Professor Pratima Murthy is taking over, and she is our in charge of the Collaborating Center in NIMHANS. So in addition to these two sort of major contributors, I'm also pleased that Indian Psychiatric Society has also contributed a significant role in promoting psychiatric training. And similarly, from an Asian perspective, Asian Federation of Psychiatric Association has also played a pivotal role. Professor Chakravarti mentioned about the meeting that we organized when I was president of EPPA in Abu Dhabi, and Professor Mohan Azek, and of course with the guidance from Professor Norman Sartorius, we were able to highlight the issue of undergraduate medical education and, more importantly, the postgraduate medical education in psychiatry. So these are some of the important milestones in the history of WPA that very clearly shows that we are committed and we are dedicated to this particular group. Now, this initiative of IAPT is indeed a welcome initiative. And I have no hesitation to say that as the contributions have always been made by our Indian colleagues, by the membership of Indian Psychiatric Society, membership of WPA, Indian psychiatrists have always come forward in highlighting what is needed and what is required in the present timings, present culture, present circumstances. Now, coming to the specific areas which I would like to add what Professor Bogra and Professor Sartorius have mentioned, that what should be the suggested areas of work of IAPT and the interest group that involves a number of psychiatric trainees around the globe, but more importantly, around Asia. I personally feel that the most important step that needs to be done and that needs to be prioritized in the current circumstances is linking. And this is what you are already doing. Probably this virtual aspect of our connections have made our life very easy in a way that now sitting in your own homes, sitting in your own offices, you can speak and share with everyone around the globe. So this is probably one of the most important initiatives that IAPT has already started, will continue in coming days. The second bit, which is equally important, sharing what are our future needs. Professor Bogra rightly said that this is immaterial that we say that we only learn from West or we only learn from a country. All of us learn from each other. And as a student of psychiatry, as a teacher in psychiatry, and as a clinician, what I feel the most important requirement or need in psychiatric post-graduation is that we need to really carry on evaluating what changes we need in our curriculum. It could be that in Indian perspective, you may be having some emphasis on some areas that UK, US, or the Western world may not be considering important. So this is how we can really link and we can emphasize about sorting out what are the important needs in international psychiatry. And then, of course, I must say that WPA, in its humble way, in its action plan, which we are committed to complete or follow during 2020 to 2023, capacity building is one of the most important areas. We have developed some action plan groups working on the capacity building. For example, Professor Sartorius is leading our action plan group on comorbidity. Similarly, we have got action plan groups on digitalization in mental health care. We have groups on developing partnership with patients, carers, and more importantly, in learning disability, intellectual disability, autism, and many other related disorders. Professor Mohan Isaac is a member of our action plan group on promoting psychiatry among medical students. And for that, our psychiatric postgraduate trainees are the best workforce. You can come up as a role model for the medical students for promotion of psychiatry as a discipline. Similarly, we are promoting educational portal system, LMS, Learning Management System, on our website. Professor Chakravarti and his team has contributed some educational modules. I think your association should help WPA to develop some educational modules that we could share on these on our WPA's website. This will be a free website in terms of being looked at by anyone around the globe. Because whereas we are restricting ourselves in terms of any face-to-face meeting, this is equally a good chance for us to use this virtual world in a more effective way. So I hope that this initiative, which has been started by our very dear Indian colleagues, supported by very enthusiastic young psychiatrists from all over the globe, and more importantly, from Asian countries, I'm sure that this will be a very, very refreshing entry into the achievements of psychiatry in an international perspective. And I can assure you that from the platform of WPA, all our blessings, support will be with you. And this really shows a very important aspect of today's program, that you have invited two past presidents of WPA. That again shows that the WPA leadership, whether this is current leadership or the previous leadership, feels very committed to strengthen the efforts of our younger colleagues. So Dr. Philip and Dr. Sachin, once again, thank to you. Once again, congratulations. And especially both of your mentors, Santosh and Mohan Isaac. You are very lucky and very privileged having their direct supervision and mentorship. And we hope that you will keep us informed about your activities, and I will be able to spread this across the world using the WPA platform. Thank you very much and all the best.